Hello, everyone. Hopefully you are logged in and prepared for our balance webinar. My name is Alicia Heading. You can see my picture right there in the screen and on the slideshow that we're going to be going through together. I am the managing partner at the Midland facility, and we also have two other facilities in Midland. We have one in the community center that is currently not open at this time because of the closure of the fitness facility itself, but we also have a location in Primrose, and we'll talk about that a little bit later. And we're at 1201, so a little bit of background on me. I did all of my undergraduate and graduate work at Central Michigan University in Mount Pleasant. I obtained my doctorate of physical therapy in 2007 and have been practicing in the Mid-Michigan region ever since. I have worked in subacute rehabs, inpatient care, and have done some home care. I love the outpatient setting. So for the last 10 years, I have been doing outpatient work with orthopedics and focusing more on manual therapy and functional training and balance programs and things like that. I also recently had the opportunity to work with some of the elite athletes during the Broadway shows that we had been having here in Michigan at the Center for the Arts and the Fisher Theater and the theater in Flint. So that was really exciting to be able to work with some of the athletes who were either trying to prevent injuries or maybe manage an injury that they sustained during one of their shows. So I've had quite an extensive portfolio of work and experience that I get to share and bring to light during these webinars and in our clinic here. So we're going to go ahead and talk about balance and fall risk in our Balance Better PowerPoint today. I'm going to start by giving you a few facts about falling and why balance is such an important part of our recovery process, whether we've sustained an injury or even if it's as we age. We always need to consider what our balance is doing for us and what things might be affecting our balance and putting us at risk for falls. So 1 in 4 adults over the age of 65 will fall each year. And less than half of the people who do fall actually report it. And sometimes that's because many people don't realize that even just a stumble, even if you don't hit the ground, that is still considered a fall. And most times people just say, oh, I'm not going to tell anybody because I didn't actually go to the ground. I didn't fall down. But any small stumble, whether you catch yourself or not, is considered a fall. 1 in 5 falls will lead to some sort of serious injury. So that could be a hip fracture, a broken wrist, a forearm fracture, sometimes worst case scenario, a brain injury or a brain contusion that could lead to not as severe as a brain injury, but some memory loss or other things like that. So falls, especially as we get older and we become a little bit more fragile, become quite scary and could even become detrimental. So falls in that older population and sometimes in the younger population are one of the leading causes of fatal injury. We've also seen in a lot of research that one fall often leads to future falls, and a lot of that is because we change our perception of ourselves and our balance and our strength. So because of that, we become very fearful of whether it's a certain environment that maybe we had a fall in, we avoid that environment, or maybe it's a behavior change. And it's like, well, I just don't walk very well or very balanced when I try to go fast. So I'm just not going to go fast anymore. Or I don't do very well outside on uneven grass. So we change our behavior patterns and we limit ourselves to not only quality of life because of that, but we limit ourselves and decrease our muscle strength, our balance overall, and just we increase our anxiety, which is also not very good for preventing balance in the future. We have a few different risk categories that we look at and that we kind of categorize why falls happen or what reasons they may occur. And we have intrinsic factors and we have extrinsic factors. We need to fully understand these categories and identify these risk factors to prevent falls overall. We're going to break down these categories little by little in some of the next slides. And you'll notice that the environmental category is starred there because this is typically the most common category. A lot of times when we fall, it's because of an environmental factor. But that doesn't mean that that's going to discredit some of these physical, behavioral, and medication factors that we also run into. So starting with the fall risk category of the intrinsic factors. So looking at physical, behavioral, and medication and other factors. When we look at our physical, we look at weakness. Do we notice that there's a muscle imbalance between the sides of your body? Do you have a history of maybe a stroke or an injury that has left you with one side being weaker than the other, which can definitely pose some type of risk for walking in different areas or regions, on different surfaces. You know, you might actually hold your posture a little bit different because of the weakness and the strength on the different sides. Do you have a balance impairment? Is there a vision impairment? Or is it just poor endurance? Do you get so far in a walk and then come to realize that you're going to have a really difficult time getting back to where you started because you didn't realize that your muscle endurance or your respiratory endurance wasn't as good as you thought it was, and now you're struggling to get to somewhere to sit down and take a rest or even back to where you started. We have found that lower extremity weakness does increase your fall risk factor by four times. So if you have any kind of ankle weakness, knee weakness, that's going to increase your factor right there. We also see a direct correlation between hip strength and falls. So if you don't have good hip strength or stability in the hips, you may also be at a higher risk for a fall. Behavioral changes, including sedentary lifestyles, cognitive changes, so people who are dealing with dementia or Alzheimer's, even some other memory loss issues, fear and anxiety, all of those will put you in a higher fall risk category. Activity levels, especially in what we've seen in nursing homes where you do kind of live a more sedentary life, and especially if you are in one of the units where you need more physical assistance and maybe you have some memory loss issues, we see a significant loss of balance in that population because of their lack of activity. We even see behavioral changes such as some facilities at one point were using alarms or maybe belts for safety. And even though it was a good safety measure, it alarmed the staff when the patients were getting up on their own so that they could go and help them so they didn't fall. It still put them in a higher risk category because they weren't getting up and moving. They had less strength, less balance overall. It's a vicious cycle at sometimes when you get to a point where you're balancing sedentary lifestyle with unsafe behaviors with, you know, appropriate activities. A lot of times the impulsiveness that we see with the dementia category and population has a lot to do with why they use those restraints and why it's so important for us to keep a close eye on them when it comes to balance, because they oftentimes don't even realize or remember that maybe they have, you know, their legs on a legs rest or their wheelchair brakes aren't locked. So they'll try to stand up and the chair won't be stable or secure and they will actually trip right over the chair. And that is a huge problem that we deal with in facilities that have a lot of dementia type behavior related falls. Some medications that we have seen that increase fall risk because of whether it's dizziness or vision changes. We see psychotropic medications. They will change your mood and your behavior. Blood pressure and cardiac medications, those have a tendency to sometimes increase your fall risk because of the changes in the blood pressure create a lapse in your stability. And I don't know if anyone has ever experienced this, but you'll notice sometimes if you get up too quickly from one position to another, whether it's laying down to sitting or whether it's from sitting to standing up, you'll notice you get a little lightheaded and a little dizzy. A lot of times that's because of a blood pressure change, and at times a blood pressure medication can resemble that same type of sensation, that lightheadedness or dizziness. And we need to oftentimes tell people to just, during those positional changes, stop, give yourself a minute or two to acclimate to that current position before you move again, so that your body doesn't get lightheaded and you're able to maintain your stability during those first couple steps rather than walk feeling that way. Diuretics, we see increase of fall risk as well, just because a lot of times it decreases your ability to maintain that level of continence that you're used to having. And so oftentimes you're in a rush. And when you're in a rush to get somewhere and you already don't feel stable, we just see that fall risk exacerbated, because now you're a little bit unstable and you're trying to get somewhere very quickly and your body is just not processing all of that the same way. And anytime we see someone who has 4 or more medications, we kind of automatically put them in a category for a risk. And it depends sometimes on what your medications are. Just because you have 4 medications doesn't necessarily mean like, oh yes, you're going to fall. But based on what those medications are being used for and what the adverse reactions or the side effects might be for those medications, a lot of times there's a certain group of 4 that will lead to some kind of fall risk increase. Some other things that we also will look at in the intrinsic risk category would be the history of falls. As we said before, 1 fall will usually lead to more falls because of fear and behavior changes. We look at gender and age. Obviously, the older we get, sometimes the more muscle strength, our posture changes. So those kind of body changes, those will come along with our age as well as lead to more risk. And gender too. Believe it or not, women at older ages are at a higher risk for falls than men. We also consider whether or not you're living alone. We look at how comfortable you are at home, how safe do you feel at home, are there any barriers for you when you're at home living alone, and do you have a good support system outside of the home that is available to you. And then we also look at your clothing and your footwear. Sometimes it's as simple as the breakdown of your shoes. It might be the fact that you're wearing improper shoes for your foot structure, and that might be putting your ankles and your legs and everything kind of working up the kinetic chain out of alignment, increasing your risk for falls and lack of balance. So there are a lot of factors when it comes to overall looking at what kind of risk category you fit into. So moving on to our next risk factor category, it's going to be looking at those extrinsic, which are the ones that are most common, the ones we see most often when they're coming to physical therapy, because it usually results in some type of injury. Because a lot of people, again, don't like to admit that they are falling or maybe that they have a balance issue, those intrinsic factors oftentimes just get dismissed as, oh, it's just me getting old, or, oh, I'm just, out of my normal today. So a lot of times we don't see people initially because of the intrinsic factors. We see them more because of these extrinsic factors, because they are resulting in an injury. So environmental factors include things within the home, loose rugs, poor lighting, undefined walking paths, uneven surfaces outside, going from grass to pavement, cracks in the sidewalk, icy areas, water puddles, things that don't look, depth perception issues. Maybe a curb doesn't really look like it's too far down, but you step down the curb and all of a sudden it's further than you expected. Misstepping of stairs. So a lot of these extrinsic things are often resulting in some type of injury once that person falls. We looked at a recent study, and this study was, these numbers were taken out of a study that looked at 3,628 reported falls. You'll find that the accident and environment related causes actually had a 31%. It was the highest category for a reason for the falls that was actually reported. The next highest category were people that actually were being treated or had brought to their physician's attention some type of walking, which we refer to as gait, or balance disorder, or some kind of weakness that led to them feeling unstable and unbalanced, and they wanted to try to figure out what they could do and how they could fix it. Down below that, you'll see we have dizziness and vertigo. We see that, and we do actually treat that here in physical therapy. And we do find that once the vertigo and the dizziness subsides, their balance is markedly improved. Other categories include arthritis type of illnesses, some kind of epilepsy, or maybe other falls from places you wouldn't typically expect, maybe falling out of a bed, or sometimes you see falling out of a wheelchair. So you can see there's a lot of different categories that actually contributed to the causes of the falls, but our highest categories are accident and environmental related causes and people who have or are worried about their walking or imbalance issues as they get older or as they realize they have some type of concern with what is happening within their own body. When we talk about falls, there's a fall cycle that we tend to notice, that everyone goes through a similar pattern. So what will happen is you'll have a fall, and whether you report it or not, you end up becoming a little bit fearful and you end up having a little bit of anxiety. So you automatically will change your behavior. You will say, you know, I fall when I did this, or I fall when I do these things, or I have fallen before. I'm going to avoid these things. So now you have decreased activity. And that decreased activity is going to lead to a sedentary lifestyle and potentially depression. So then again, you're adding maybe more anxiety, more fear, because what am I going to do if I sit here all day? I can't sit here all day. You're leading, which leads to inactivity, and again leads to more weakness. So when you have weakness, we know that weakness directly correlates to poor balance. This is a vicious cycle. And once you have one of these risk factors and you increase more of these risk factors, you're automatically increasing your risk for falls. So a risk of falling is increased from 8% for persons with no risk factors to 78% for persons with 4 or more. So if you think about how quickly one risk factor in this fall cycle transforms into multiple, you go from 8 to 78% just by adding a few more risk factors. And that's a scary thought. A 78% chance of having a fall is pretty scary. So what are some things that you could do when it comes to how can I prevent a fall? You know, how can I make sure that this is something that I have on my radar? Well, the most effective fall prevention strategies are multifactorial. It's not just one thing. You know, if it were one thing, it'd be super easy. But unfortunately, we need to look at all of the risk factors and all of the categories that you may fit into and see what we can do to balance all that out. So we're going to look at identifying risk factors. We need to assess for your medical need, maybe visit your providers and talk about, do I have any issues that put me at risk for a fall or balance? You know, how are my medications doing for me? Talk about weaknesses that you may have, or report those falls. Even though you didn't hit the ground and you stumbled and caught yourself on the counter, you know, talk about those with your physician or even a therapist if you get to come to one of us first for something different. Maybe you're coming to us for a shoulder pain. And you're like, by the way, I kind of want to touch base on an issue that I've been noticing. I've been having more trouble walking. And we can walk through some of these fall risk categories and prevention steps with you. We would complete, if we needed to, the necessary assessments to assess your balance. And there's different components of balance. Is it just a strength issue? Is it a sensory issue? Do you have a change in the sensation of your feet due to maybe neuropathy that is leading to decreased input from your feet to the brain, telling you whether you're on a stable surface or not? Is it a vertigo issue? Some people don't even realize what vertigo is. They just think, oh, I always get dizzy when I stand up. And that could be a blood pressure issue, or it could be a vertigo issue. So again, it's nice to figure out and talk to somebody about what's happening and why it's happening so that you can understand the problem and hopefully find a solution for it and not fall into one of these categories of an increased fall risk because of it. At physical therapy, like I mentioned, we treat a multitude of issues, and falling and balance programs is one of the things we incorporate into almost every program we have, just because if you come to us with some kind of weakness or an injury or a dysfunction of some kind, typically 9 times out of 10, you're going to have a lack of balance too, either because of disuse of that body part because of the injury or weakness, or because of an inability to use it as you normally would. And so our program evaluates everything from strength of that specific part you're having problems with to your entire posture, to make sure that we understand where there's a breakdown in your muscle chain, where there's a breakdown in your movement chain, so that we can understand what risks you will have. We use standardized tests such as the Tonetti test and a Berg test and a dynamic gait test. These all look at different components of balance. Some of them look at your balance while you're moving. Some of them look at your balance while you're standing in one place, doing different tasks. Maybe it's picking something up from the floor or standing on one leg, turning around. And the other one looks at your balance while you walk on different surfaces so that we can fully assess all of your good components and your not good, some good components, and put them together in a program that's specific to your needs. We always look at what weakness and strength areas we need to implement, so we'll give you exercises to do. Again, I can't reiterate how important strength is when it comes to maintaining balance and decreasing your risk for falls. As we saw, one of the main things in the intrinsic category group was the fact that lower extremity weakness increases your risk for falls by a factor of 4. So we always want to make sure that your strength throughout your legs and even your posture, because postural dysfunction and postural strength has a lot to do with fall risk too. We always want to make sure that those things are addressed. Our goal is always to make sure that you stay as active and as independent as you possibly can. Breaking down each part of that a little bit better. So when we look at strength training, we're going to do a lot of upper body and core and lower extremity strengthening to make sure that you are pretty much symmetrical and equally balanced throughout all of your exercises as well as all of your movement patterns. We look at postural reeducation and alignment of your spine. Sometimes as we age, we find that our body tends to tip forward and become very rounded in our spines. And you'll notice that when you can't stand up straight, sometimes it's harder to control your momentum with your movements or even your momentum during walking. And you find yourself, the further you walk or the longer you walk, almost like there's a weight or a heaviness on your shoulders or your spine that tends to pull you further forward. And again, gets you closer to the floor and takes away from your center of balance. So rather than walking upright, nice and straight at a good pace and with good momentum, you end up slowly kind of falling forward, and all of a sudden you have to stop, readjust, and continue your walking path. So posture is a huge component of it too, and making sure that you have good postural strength during your upright activities. Again, we do gait training, which is basically walking training, some kind of movement training, making sure that you can walk on different surfaces, up and down stairs. What kind of modifications would you need when you do those things if you don't have the full strength to do them? Do you need handrails? Would it be ideal for you to use a cane when you're outside on slick surfaces or on uneven ground maybe? Or maybe it's just something looking at endurance training and figuring out how far is an appropriate distance for you to walk before your body needs that rest, or whether or not you can walk further with the assistance of a device, maybe a cane, or something that gives you a little bit of external support to take some of the stress off of your muscles and give you better endurance. Obviously, for a fall risk program, we're going to look at balance training and coordination, how to coordinate movements in different areas, small areas, what to do in close quarters, maybe opening a door. We look at a lot of times backward motion seems to be really difficult for people who are fearful of falling. And that puts a different type of anxiety when it comes to, well, how do I get out of this space? I have to walk backwards. I don't like to walk backwards. I can't see where I'm going. So we look at how to position you, where to stand, how to do those things. We'll also, if you're coming for something like vertigo, that requires some specific training, such as focusing on an object while you walk or learning how to adapt to a specific position. We'll do some adaptation training and some what we call gaze stability training, as well as educate you and any family that may be necessary. Maybe you live with a significant other that's concerned and would want to know how to help you continue with your exercises, or if you were to have a fall, we might go over training on how to appropriately help you with that fall. We always want to make sure you're safe and the other person's safe, and when you know to call 911, or if you fall and you're able to get up on your own, how that other member of the family or friend could be there to help guide you up if you're able to get up on your own. So all of those things are something that we would address in physical therapy. We do have a few exercises that we like to give to people for home programs to work on balance that specifically target certain areas of those high risk factors. So we look at hip strengthening, we look at static balance, which is standing in one place with a support system, so you don't have to worry about falling down when doing these exercises, and knee and ankle strength. Now, I don't usually give a lot of core strengthening activities out initially, because again, everybody's core strength is at a different level. And sometimes certain core activities are too challenging for others. And so again, when we come to the point where we're ready for exercises, everybody's program can be quite individualized and quite different. However, these 6 exercises are fairly standard for general mobility and hip strengthening and balance when it comes to a beginner program. So the first exercise you'll see here is a single leg balance. And I would always do this on both legs. Even though you might have a weaker and a stronger side, I would always preach how important it is to have symmetry and good strength on both sides. So I usually tell people, stand at a countertop, even a chair, but sometimes if you're really concerned or if you're putting too much weight on that chair might become a little unstable. So I prefer countertops. And you want to work on standing on one leg with a nice soft knee. And by soft knee, I mean a little bit of a bend. You don't want to have that knee locked out and put stress on your joint. So one leg with a soft knee, and start with 15, maybe 10 to 15 seconds. And ideally, you would want to work up from that 10 to 15 second hold on each leg to 30. A 30-second hold on one leg is phenomenal. And as you get stronger and you can progress, you might start with your fingertips on the countertop, and you might hold on with both hands, and that's okay. But as you get stronger, maybe you start to do that first 15 seconds with one hand. And if it becomes too hard, you put that second hand back up, or maybe you make it all the way through to that 30. Another way to progress that is maybe you go to maybe a fingertip or two, and you learn how to balance with just very little support. And eventually, maybe you're standing with just your hands hovering over the table so that you have something to hold on to if you need it, but you're still challenging yourself. Now, if you get to that point, one, I would make sure that you're very stable and you have the ability to do that. We don't want to encourage any falls at home. And two, if you are a little unsure, don't try it alone. Make sure you have someone at home with you and that you have some support nearby, maybe a chair behind you, so that if you do feel like you need to sit down right away, put that other foot down and go ahead and sit down. Or you have that person by you if you feel a little bit too much sway, that you have that person there. Again, 2 hands to start initially is always great. Even if you're using 2 hands for support, you're still re-educating the muscles in the leg and the body to learn how to accept the balance and the weight on one foot alone. So another one is changing the direction of the balance of that foot. So it might not make sense right now, but if you were actually stand up and when you try these things, just holding the leg up behind you in the air, like the first picture, puts a very different stress on the muscles as if you were to hold the leg in front of you, like the second picture right here. And the reason why we do both, you're like, well, what's the difference? I'm still only standing on one leg. Well, if you think about where our body goes and what our legs do when we're walking, when we take that first step, our one foot will swing out in front of us to strike the floor or the ground ahead of us with the heel. So we don't walk around lifting our legs up behind us. So it's important for our muscles to understand the balance and control that they need as one leg begins to go in front of the other. And it does, it changes the stress on your core, it changes the stress on your spine, it changes the legs throughout the whole leg. So that's why we oftentimes, even if you're coming into therapy, we will do balance activities in a very different kind of environment every time. We might have you standing on something firm, something soft. We do it in a lot of different positions. We might have your leg out behind you, the leg beside you, the leg in front of you, one leg higher up than the other. So we're constantly challenging your body to make sure that your body can accept all the different stresses and challenges that come with those different positions. And then if we look at good general strengthening exercises, the hip flexion exercise where you're standing at a countertop or maybe a chair, and you lift the one leg up at a time to about waist height. And I like a repeated lift. Sometimes it's good to do an alternated lift, but initially I start everyone with a one-sided lift. So 15 times on one side at a time. What that's going to do is it's going to build up your strength in those front hip muscles, but it's also going to build up muscle endurance. So with every exercise that we do, the more repetitions you do, the better muscle endurance you get, as well as strengthening that muscle as well. So I like to start with one leg at a time. As you progress and as your balance improves, you may want to try alternating right to left, because now not only are you strengthening your muscles, but you're also changing your center of gravity, which in turn is also a nice balance challenge. Another very important muscle is the outside muscle of your hip. So this exercise, you're actually going to take that leg directly out to the side, and don't worry about how high it is. Height isn't necessarily what we're going for here. It's actual movement and good muscle contraction. So form is always key. If you're just swinging that leg as high as it'll go and your body is all over the place, hone it in a little bit. You're not doing yourself any favors because you're basically relying on momentum to do the work for you, and your posture is all out of alignment. So you're not going to see as much of a greater change as you would if your movements were small and very direct and very controlled. So again, it's just a nice, and I'll even demonstrate for you, if you can see. It's a very nice lift out to the side, just past the line of the body, if you can see, and then back to the center. So again, we're not looking for height here. We're just looking for nice controlled movement. Another tip that I like to tell people is you want to pay attention to where your feet are going during this one. The muscles in the front of the leg will always try to cheat your body, and they will actually try to take your leg and turn your toes out. So you kind of rotate your leg as you swing, and you don't want that. You want the muscles in the outside of the hip to be doing all of the work with this motion. So your feet, your toes should stay pointing forward the entire time you do that lift, okay? You don't want them to turn out. Another great exercise that we have people do are squats. And these don't have to be low squats. Mini squats work just fine, especially for my clients who have knee pain or knee issues. We may even avoid certain squats in the beginning until we get some of the other muscles stronger. So don't think that you have to drop your butt all the way down to the ground or even 90 degrees to do these squats. Even just a small knee bend is going to be sufficient in the beginning, and you will gradually work your way into a different position. Another thing with squats is you want to make sure, again, you're standing with at a nice stable surface so you have some support. And you want to make sure your hips come back behind your knees. We don't want your knees going too far forward. So again, I'm going to show you. So if I'm going to do a squat, I don't want to go this way, okay? I actually want my hips and my butt to go back this way, like I'm going to sit in a chair. So we want to go all the way back. I know it's hard, kind of weird to pay attention to half my body moving. So again, you don't want to do a squat like this, okay? You don't want your knees to come up way like this. We don't want that. What we want for good strength with your squat is your hips to actually go back, like you're going to sit in a chair. And the last one for your ankles, because we do a lot of, flexing and plantar flexing, so up and down motions of our feet and ankles when we walk, is a heel raise. So it's just, again, rising up onto the toes and the ball of the foot and then dropping back down. Straight up, straight down. Try to make sure that when you come all the way up, you're not rolling your ankles out, that everything kind of stays facing forward. One, because you don't want to put extra stress on the outer ankles. And two, you don't want to put yourself at risk for a sprain in your ankle by rolling too far. So straight up and straight down. What I would typically do is I would typically do about 2 sets of 10 to 15 of these exercises. And you could try them once a day. If it seems to be too much, you could do 3 times a week. But as with anything, what we would always tell everybody, if any of these exercises either seem too difficult for you and they're too challenging and they put you at a risk, please don't do them at home. And also, if you find yourself having any increased pain with any of these particular movements, again, please stop the exercise. Pain is typically an indicator of an issue. And so if you are having pain, definitely reach out to your physician right away. Let them know you're having some pain with some movements. We can take care of that for you. You can come in here and we can address that. So pain is not a good thing. So do these exercises as long as you're not having any of those complications. We do also offer free screenings here, free injury screenings, as well as free balance screenings in our clinics. So if you have a concern and you're not really sure whether or not it's a big enough concern that you want to go see your physician, I understand, and I'd be more than happy to kind of have you come in. And it takes just about 15 minutes and go through some of your concerns with you and maybe do a couple tests or two and see what I can find and let you know whether or not a program like this would be good for you. So please don't avoid it. Getting help sooner rather than later always seems to have a better outcome. So what can you do right now? If you are in a house where you have a lot of those environmental risks, please get rid of all that clutter. Get rid of the loose rugs and the cords that might maybe go across a well-traveled area. Add some lighting to your hallways if possible, so that in the night when you wake up, if you wake up in the night to use the restroom or just because you can't sleep and you're going to a different part of the house, that you have a better sight of vision, a line of sight that you can clearly make it there without any other things getting in the way. If you have young kids or dogs or cats, maybe they left something and you don't want to trip on something. So some new lighting or additional lighting might work, little night lights. If you have issues or balance concerns in the bathroom, in the shower, maybe consider getting a raised toilet seat or adding some grab bars in or around the showers or in the bathroom. They have nice suction cup ones that you actually don't have to drill into your wall that are pretty stable. And you don't have to worry about any damage to your room or anything like that. You can take them with you if you ever leave that home. So that might be a good idea. Making sure your handrails are present and stable and sturdy. And then making sure you're using your devices correctly. And by device, I mean your walkers, your canes. We have so many people sometimes that would come in and we notice their cane maybe isn't tall enough for them, or maybe it's too tall and it's putting them in a little unbalanced situation where they almost look like they have a limp, but they don't. It's because their device is at the wrong height, or maybe they could be using a different device that would work better for them. So these are all things that we would look at that would be able to help you with. And lastly, make sure that things are frequently used items are in a good reach. So if you use a certain cleaner or a certain bowl every time and you have a really hard time looking up or kind of moving backwards because of maybe it's dizziness or weakness, make sure those things are out of those high or low cabinets and maybe more level on the countertop or in a place where they're easily accessible. So like I said, we offer free screenings for balance and injury. So if you're having any kind of concern, always feel free to reach out to us. We have all of these locations in the Mid-Michigan Greater Lakes region. But like I said here, I am at the Midland Clinic. We are on Wackerly, and we are just between Eastman and Sturgeon. So we're not too far out of town. We're just on the side where it seems like every medical office is on Wackerly Road, but we're on the opposite end. We also have our clinic, which is soon set to reopen in the community center. Once the pandemic ends and once we're able to get people inside that facility, we will be able to open up there. And I want to let you know that we also have a physical therapy site on in the Primrose retirement community. So if you have a family member there or friend there that you could think might benefit from some balance training or an exercise program because they're at risk or maybe they have some other issues, please don't hesitate to reach out to us. We can make sure that we set up a program for anyone, regardless of where you're at. If you can make it to any one of our 3 locations, despite the community center right now being closed because of the pandemic, we can help you with that. So lastly, we're going to move on to a couple questions that we had submitted. And if you have any other questions, feel free to drop them in the Q&A box real quick. We have Kate on the back end who has been helping us moderate this whole session. So she'll be able to read those questions out if you're able to get them in.
Thanks, Lish. That's a lot of great info. We do have 3 questions. The first one, somebody said they're dealing with balance issues due to Parkinson's disease and wondered if there were any different recommendations for Parkinson's.
Yes, so that's a great question. Parkinson's definitely has its own set of challenges. What we see a lot of times with Parkinson's is we see a lot of postural instability, a lot of decreased movement patterns. So the movements seem to be very, very labored, very shuffled, and very short because of the tremoring and the muscle tightness. And what we have found that exercise will definitely help improve your movement patterns and your balance if you have Parkinson's. The postural dysfunction, the rigidity and the instability you find that comes with that diagnosis doesn't necessarily change automatically, and there's not a lot that we can do to prevent that from continuing to change. But exercise will definitely maintain a certain level of strength and flexibility that you'll need to have better posture during movements and improve your movement abilities. I don't know if anyone is familiar with the Rock Steady boxing program here in Midland, but I know that that's a great place. It's interesting because it's based around Parkinson's. So after you go through maybe a balance program and you get to the point where you become more active and you're more balanced through doing your therapy and your home programs, we have a lot of different opportunities in Midland right here to help you maintain that level of movement and maintain that balance once you complete an initial assessment. So there are a lot of concerns when it comes to balance with Parkinson's. One of them being the posture related aspect and the weakness that comes with that. But yes, you can help change that a little bit and maintain strengths to put you at a less risk.
Great, thank you. The second question, somebody asked how much core strength has to do with the walking balance. I know you mentioned core a little bit, but they want to know specifically in regards to walking.
Yes, the core strength has a lot to do with everything we do. It is the center of all of our movement. It is the center of our balance, essentially. So without good core strength, our movements will be more labored. Now, that doesn't mean you have to have six-pack abs and perfect posture and a superb core like a gymnast to not fall. That's not necessarily the case. But if we take and we can improve certain aspects of your core, because the core is made up of multiple muscles. So maybe the one muscle that seems to be the weakest is the spinal muscles, or maybe the one muscle that seems to be the weakest is maybe the pelvic floor musculature. We find that if we can help improve a certain portion of those muscles to an extent, then overall that will improve your core, which will also reduce your risk for falling. And again, the hip and the pelvis area is a huge factor when it comes to maintaining stability. So between strengthening the hips and strengthening the core and doing a little bit of work there, both of those are going to give you a better outcome when it comes to decreasing your fall risk and improving your balance.
Excellent. We did have a few new questions that came in. Some people are asking where we offer the free balance screening, and you can get that balance screening at any of our locations.
Correct.
And if you visit renuept.com, that's RENUEPT.com, you can contact any of our locations. The next one, somebody said that they have a hard time standing on one foot for very long without falling over. I know you mentioned some exercises, but if you had any additional recommendations for that challenge.
Yeah, that can be really challenging. So standing on one leg is a difficult activity, and it might be that you can't do that one because of your balance, but it also might be because of other pain limiting issues. Maybe you have arthritis in your ankle, or maybe you have arthritis in your knee, or some other kind of ailment that's keeping you from doing that. I would suggest one, if that's the issue, definitely go to your doctor, get it looked at, figure out what we can do to help from a medical standpoint. But also a lot of times what I will tell people who are having trouble standing on one foot initially is to stand with the one foot that you're planning to stand on alone, nice and flat, good and strong, but to put just the tiptoes down, and I'll kind of show you here. On the opposite foot, to get to a place where you can see my feet here. So I'll have them. All right, you guys are going for a ride, coming down to see my feet. Okay. So what I'll tell people to do is stand on one foot, but bring the tiptoes of the other foot down so that you still have a point of contact, but it's not all alone. You know, it's not completely on its own. So just having a little bit of your foot down for some pressure and some contact on the ground is still going to make the leg that's fully flat on the ground do 90% of the work. And you can vary how much contact you have in this foot. Maybe it's a little bit more. Maybe you need the whole ball of the foot. Maybe it's just the upper half and the toes. So you can, again, change that based on what your level is at this time, and hopefully still get the benefits of the exercise of standing on one leg without having to completely stand on one leg alone. All right, coming back up.
Great, that was very helpful to see. We have one more question that I'll answer. Asked if we have a webinar coming up on core strengthening, and we actually do have a webinar that's scheduled for August 12th. I'll make sure that information is in the follow-up email so that you can register for that one if you'd like as well. Otherwise, that's it. If you have anything else to add, but otherwise, thank you for sharing all that great information.
No, my pleasure. Thank you for logging on and taking the time to listen to us and figure out better ways to improve yourself and better your balance. Again, like Kate had mentioned, and we had mentioned in the beginning, if you have any questions or concerns, please reach out to us via email. You can get to us from our website, or you can call me directly and speak to either myself or Nicole, who handles our front office. And she is able to answer a ton of questions questions about scheduling or how to or free screenings at 989-423-1240. And she will be able to, or I will be able to answer many of your questions. So once again, thank you so much for attending, and we hope to see you guys in the near future if you ever need any help.